Hi, friends. Welcome to another podcast in the series of Proctology and Laparoscopic Surgery. This is Dr. Ranjan Tripathy, Proctologist and Laparoscopic Surgeon with you. Today, I'll try to highlight some basic information about one of the very common disease which we encounter, that is hernias. I'll briefly try to explain what a hernia means, how to recognize early signs and symptoms of a hernia, and do we need surgery for hernias. Coming to the first part, what is a hernia? Hernia is an abnormal protrusion of an organ or part of an organ through the walls of its containing cavity, that is, the muscular wall that usually keeps the organs in place. Since the abdominal cavity is the largest in the human body, so abdominal wall hernias are the most commonest ones, and we'll discuss mainly about that. Hernias can either develop primarily without any predisposing causes. Many of them are congenital in nature also. Secondarily, hernias can be formed due to any cause leading to increase in the pressure inside the abdominal cavity, like chronic cough, constipation, straining or difficulty in urination, large intra-abdominal tumors, poor nutrition, etc. Hernia can also form due to previous surgical procedures, which are a special category called incisional hernias. Tobacco use in any form have shown to increase the chances of hernia formation. We usually encounter three common varieties of hernias, that are groin hernias, which are again inguinal hernias in the lower part of our abdomen, maybe either on one side or on both sides, or femoral hernias, which are relatively less common. Umbilical hernias or the belly button hernias, which is very frequently seen in different degrees, and other ventral hernias or midline hernias, which occur in the center of the abdomen. How does a hernia usually present, or what we feel when we have hernias? Initial symptoms of hernias include feeling of a bulge or lump in the affected area. Patients may have vague discomfort or dragging sensation, particularly after physical exhaustion. Sometimes they may have severe pain, which usually occurs when the hernial contents get blocked and cannot be pushed inside the abdomen. Uncomplicated hernias usually do not cause much pain as long as they can be pushed back into the abdomen. We call it as reducible hernias. Patients typically feel the discomfort or bulge on prolonged standing or coughing, which usually subsides on lying down. This is the commonest presentation which the patients tell us. They usually say, "Sir, we feel the swelling when we are exhausted or standing for prolonged time, but when we lie down, we don't have any problem." Usually, hernias do not get better on its own. They may become bigger, and in some cases, it can lead to life-threatening problems. That's the reason hernia treatment is often recommended. Now coming to the most frequently arising question regarding hernia in patient's mind. That is, do I need a surgery for hernia? Or do all hernias need surgery? If you ask me, the simple way to put it is, yes, almost all of the hernias need surgical intervention, but it's the size of the hernia, patient's associated medical conditions, and clinical symptoms which decides the urgency or timing of surgical treatment. A patient is an ideal candidate for hernia surgical treatment if any of these things happen. Incarceration. It's a condition when tissue such as intestine or fat becomes trapped in the abdominal wall in the hernia. If it is not treated, it may lead to strangulation and then the blood supply of the tissue or organ gets cut off. If the hernia becomes strangulated, it can cause permanent damage to the organ, which may have to be removed. It's a dire surgical emergency. If the hernia is growing larger and is causing increasing pain and discomfort to the patient, they are ideal candidates for surgical intervention. Of course, patient may be able to wait to have a surgery if when on lying down the hernia goes away, or he or she can push it back into the belly. If the hernia is very small and there is few or no symptoms, patients can electively get the repair done. It is recommended to keep a watch and monitor the hernia during the yearly physical examinations. Once the decision for surgical treatment of hernia is done, hernia surgery can be performed in one of the two methods. One is the classical open surgery, wherein the surgery is done either under a local or a regional anesthesia, involves cutting of the skin with a moderate to large size incision depending on the size of the hernia, and basically involves pushing back or reduction of the hernial contents into the abdominal cavity and repairing of the hernia site either anatomically with tissue repair or with mesh, prosthetic mesh plastic. The most advanced method of hernia repair in today's world is laparoscopic hernia repair. Herein, the patient is usually treated as a day care. The abdomen is inflated with small incisions using medical grade carbon dioxide gases. The surgeon inserts a telescope inside the abdomen fitted with a camera, usually a high definition one. With the help of the laparoscope, the surgeon can see the hernial anatomy clearly and uses it as a guide to repair the hernia with mesh. The biggest advantage with laparoscopic surgery is the recovery time. It is very fast compared to open surgery. Patient can get discharged on the same day and are back to their normal routine a week sooner than with open surgery. However, depending on the size, type and location of the hernia, surgeons recommend the type of surgery required. There are some other factors like lifestyle, health and age base on which the doctor will decide the type of surgery. That's it for today, friends. For further information regarding this, you can check out on our website www.drmanastripathy.com. Thank you everyone for your patient listening. I'll catch you soon with another important topic. This is Dr. Ranjan Tripathy signing off.